right, welcome back. We're talking your health now regarding prostate cancer. Joining us is Dr. Lee Humble, a urologist on staff with P&S Surgical Hospital. Thank you so much for joining us today, Dr. Humble.
Well, glad to be here.
Now, few questions. You're going to be telling us about the prostate cancer awareness and some important facets of the disease.
Yes, prostate cancer awareness is critical. Prostate cancer is the leading cause of solid malignancies in men in the country. It's also the second leading cause of death, even though we often think of it as a disease with low malignant potential. It definitely is one of the cancers that can cause death.
Typically, what age does one need to start being screened for something like this or start being aware of this?
In general, we screen for prostate cancer in the 50 to 75-year-old range, but there are certain instances where we start earlier at age 40.
Really? Yeah, yes. I know. My dad is approaching 60s, so he's been more aware of this and going through this as well. So.
Yes.
Is it something that can be cured if it is discovered?
Certainly it can be cured if discovered early. Early diagnosis is critical to be able to provide patients with options for cure. Even when it's diagnosed after it's spread from the prostate to other organs, it can be managed, but it can't be cured. We really want to emphasize cure, so we want to emphasize early screening so that we can have an opportunity to provide patients with that option.
Can you tell us what causes it? Is it a hereditary issue? Is it a lifestyle issue?
There's definitely hereditary factors. In fact, I mentioned that age 50 is when we start screening. However, there are certain populations, black men, any man who has a family history of prostate cancer, that should be started with their screening at age 40. So hereditary does play a factor. We also have factors such as diet. High-fat diets are not good. There are also environmental causes, such as exposure to pollutants or certain industrial agents which can cause it.
And I know that one of the biggest things you want to talk about is prevention and screenings and some other things people can do if maybe someone has it's hereditary in their family. I mean, what are some of the steps they need to start taking?
Well, again, screening starting at age 40 is critical for those patients. That would involve having a prostate check, a manual examination, as well as PSA screening. PSA is an antigen that's found in the blood of men, and when prostate cancer develops, it tends to rise. A rise in the PSA is not exclusive to prostate cancer, but it does give us a tip that there could be prostate cancer present.
Where can people go to find more information in our area? Is there a website or a phone number or an office they can visit?
Well, of course, they could visit your primary care physician. Will have good information. Of course, urology clinics will have that information. And there are several areas on the web that can be evaluated, including sites on the American Urological Association websites.
Great information. Thank you so much, Dr. Humble, for joining us today. We'll be right back right here on Louisiana Living.